start. Wayne,
We are live.
good morning and happy new public health year to the Metro Louisville Board of Health and to the community. The chair calls this virtual meeting to order and welcomes the listening and or streaming as we ourselves are being streamed live on Facebook. Due to our speaker's commitment, given the state legislature is in session, we'll address two action items first, and we'll also wait for him as I watch my screen, John McCarthy. We'll do those two action items first, as I mentioned, followed by the prospective session, then some additional business and discussion items, and of course, any committee updates. So the draft minutes of the November board meeting have been distributed. Is there any discussion, edits, etc.? All right, hearing none, the chair entertains a motion to approve the 2023 November board meeting minutes.
So move.
Second.
Any objection to that motion?
I can't see you guys. This is Margaret. I'm having trouble with the WebEx link. Can somebody send it to me again?
Who is this?
This is Margaret. Is this Heidi?
Yes.
I'm sorry. Is this Heidi?
This is Heidi. And Christina, can someone from Kathy Turner's team or someone help?
Yes, we'll send her the link.
Thank you.
I can't seem to open the link today. So if somebody could send it to me again, please.
We're sending a new link.
Okay, thank you.
Alrighty. Let's see. So we've approved minutes. Natalie Johnson, Assistant County Attorney, I believe you have an item that puts another finishing touch on the transfer of certain property to family health plans. Ms. Johnson?
Yes, good morning. This is Natalie Johnson with the Jefferson County Attorney's Office. And this was a while back when the board transferred property to the Family Health Center and also to another piece to Metro government. And as part of that agreement, the board was going to pay the cost of the title exam for the property at 400 East Gray Street. And so I just need a resolution to pay that amount. It was $1,371. And that was really it. Just a resolution agreeing to pay that for that title exam.
Okay, and we have a resolution to do that. And is there any discussion? And hopefully, Chief Justice for the board, this really is concluding the transfer of the property. Is that correct?
Yes, we're waiting on just signatures from the Family Health Center and from Metro on the deeds, and that is it.
Okay, well, Dr. Irwin's on. And
your eyes look good.
So is Ms. Shoemaker, so I think we're good.
Yep, that'll happen Friday.
Yes.
Very good. So is there, Ms. Johnson, is there anything else we need to do here?
Just vote to approve the resolution.
Okay, then all in favor of approving the resolution as we just discussed and as was previously distributed, please say aye.
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 Abstentions? Motion carries. Property is officially transferred with signatures, etc. Are we good to go, Ms. Johnson?
You are good to go. I will send you the resolution just to sign,
Yes, ma'am.
and that's it.
Cool.
Thank you.
Interim
how about
Director Connie Nendel is actually, I think, on a
Same
plane.
here, same.
Pardon? Is actually on a plane right now, and I believe Stacy Ingram, the Director of Health Services, is going to answer this question, not give a report, but just answer the question. Are there any action items from your area that need approval by the board?
No action items at this time, but our FY23 annual report and all relevant information was included in the director's report.
Thank you very much. All right. And I see our speaker has joined. I got it located. There he is.
Hi.
And I promise not to give away any internal trade secrets here, John. With these governance items behind us, it is indeed one of the proudest honors I have to present our prospective session speaker, John McCarthy. I need to take a point of personal privilege first, though. I hired John at the Humana Healthcare Plans. In fact, he was the first Kentucky State Affairs Director, and was it the mid 90s?
Yes,
Like a different era.
95.
Today, as the longtime founder and managing partner of McCarthy Strategic Solutions, John is regarded as the most experienced and connected Republican lobbyist in the Commonwealth, with over 3 decades of managing political, policy, and corporate operations. In full and fair disclosure, John worked for both Humana and Columbia HCA. Some of you may recall he ran Ron Lewis's first and very successful campaign for 2nd District Congressman. Of course, Congressman Lewis remains a representative today. John opened his lobbying shop in 2005 after many years as a political operative and government official. He served as chairman of the Republican Party in 2004, and in August of this past year was elected by the state Republican Party as their national committee man on the Republican National Committee. While John's resume reflects his Republican record, he is well respected for his continued reach across the political aisle. And another point of personal privilege, I haven't disowned him yet. And he hasn't disowned me yet. So, an indefatigable fundraiser. He also works with both of Kentucky's U.S. senators and federal, state, House, and Senate leaders. In Frankfort, John was instrumental in flipping both chambers to Republican control. For us, he will outline the legislature's top priorities, as well as highlight those that impact public health and health care. He'll also share insights gleaned from decades of local, state, and federal policy and advocacy in both the public and private sectors. John is a Centre College grad, lives in Louisville with his wife, Cindy, and their 3 daughters, Austin, Eloise, and Charlotte. I think John's mother was sending him a message, as his sisters were. So he also volunteers his time to many community nonprofits and service organizations. So this gentle lady, and you can't make comments about that, John, gentle lady from the county of Jefferson yields to the gentleman from St. X. The floor is yours.
Thank you, the lady from Jefferson. I appreciate that. Very kind, very introduction, and to the members of the health department board for Jefferson County. Thank you all for your participation and your involvement. You all have had, 3 years of challenging times with COVID, and I know that working with Heidi and working with others within the city, the job you all did to keep people, and what you could do to keep people healthy and safe, and that's your mission on a daily basis. Someone who used to go to the health department to get my vaccines before school as a kid because my mom didn't want to go pay a doctor to do it because the health department was able to do that. I remember those visits, and remember I had a sister who also worked for the Lincoln Trail Health Department and who was an environmental in the environmental portion and worked with, permitting and restaurants and things like that. So my oldest sister, Kate, down in, she lives in Bardstown. So I'm aware of the work, the many, many facets of the work of a health department provides. And then I actually went to school with Paul Linton, his father worked for the health department for many years here in Jefferson County. So I give you that background so that you know where I speak from. There's a little bit of knowledge about what you all do. We have clients that interact with the health department as well. Volunteers of America is a client of ours. We have the University of Louisville Healthcare. We have, the apartment associations, the home builders association, a number of different groups that we work with that interact with the health department at some sort of time of them providing a service or the business that they're into. So you play a vital role in our community, and I just want to say how much we appreciate what you do and keeping our community healthy and those who visit our community as well. In the years of understanding healthcare, and Heidi is correct, I started with Columbia HCA, started with learning about healthcare, and I tell people all the time I've had a really good career in the healthcare world because I knew the difference between Medicare and Medicaid. But as you all well know, there's more to the world of healthcare than just the payment, although payment is really important and resources are critical. And, you all have a budget and you all work within that budget. And then there's opportunities to partner with the state on other healthcare missions and priorities. You all have been a vital partner with the effort on the homelessness in Kentucky and in Louisville, the addiction recovery care, the community health workers program and rolling that out. I will tell you, I was with the speaker, David Osborne from Oldham County. Most people don't think he probably thinks too much about healthcare, but he bragged about Kentucky's investment in community healthcare workers because it is the long-term benefit of those type of investments to get care where people need it and when they need it. They're going to help curb the long-term cost of healthcare over a period of time. So there's very thoughtful efforts that go into these policies and decisions at the legislative level that are priorities for how you all as an organization deliver the services that you provide. The General Assembly has gotten past its probably second most important day, which was the filing deadline in 2024. They moved that up. It used to be late in January, like the last Tuesday in January. They moved it up to the first Friday in January. That's a change. There are a number of incumbents who have primaries on both sides of the aisle in both the House, more in the House. I think there's 22 incumbents that have Republicans that have primaries. I think of the 20 Democrats, I think there's 11 that have primaries and some multiple candidates. We have legislators from Jefferson County too, Josie Raymer, Democrat, and also Kevin Bratcher that are moving from the legislature to the Metro Council, and because they want to be serving closer to home, and pays a little bit better too, and but it is closer to home. So these changes, while they don't impact some of the voting trends, but they are important to pay attention to because those folks that are going to be in these decision-making roles that impact directly the function and the ability for you to perform your duties, it's really important to know who they are, in my opinion, and to get to know them somehow, some way, whether it's through the action or whether it's you live in their district, and where appropriate, the contact and communication you have with them is critical. Heidi knows this. I played sports growing up. I played football in college. And I told Heidi, I think when we interviewed together years and years ago, the reason why I like politics, it's because it's the only thing that replaced football as a full contact sport. And, that full contact is the contacting of, the relationship building you have with people. That's what I enjoy the most, the strategy. Much like a football, coach, the strategy of how to move your issue forward in the sea of all other issues that are priorities, and how do you find your path. Lobbyists are kind of like water. We always find the cracks to get in where we need to get in, and that's what we do as lobby. But at the same time, what we've learned is you have to educate folks at both the top and at all levels of a structure of an organization, so that when it's decision making time, everybody's on the same page. And that it isn't always easy, but at the same time, that's what we do on a regular basis to help carry forward where we're headed for this legislative session. They first Health and Welfare Committee meeting, they spent the majority of the time in the Senate talking about childcare, talking about all the aspects of and where Kentucky is and comparatively, and talking about childcare. It's very important. I think you're going to hear more and more conversations. You've heard the governor lay out the agenda of early childhood education and trying to fund that, trying to find a way to fund that. Some communities have done really well with this. Northern Kentucky, for example, has had a program in place for the last 10 years, and their first graduates are now entering in, getting ready to graduate high school. And their early childhood involvement, which was a public-private partnership, and health departments up there were involved with the schools and trying to help make sure they identified folks who had whether it's health challenges, disabilities, and early recognition of learning development issues that were caused by general health were important. So I would envision you're going to see somewhat of a conversation towards a model like that, where it won't all just be in one sector of government's responsibility, but it's going to be more of it has to, in order to work, has to be a community approach. And some of that has to do with making sure there's enough qualified providers, making sure the facilities are available, making sure, but that is a really important to the growth of economic growth and opportunities of the modern family is quite honestly one working parent, single parent, or two working parents. The number of stay-at-home individuals with children the numbers just are not as what they used to be. So it's just that sometimes we have to catch up in our community. So I would look at that as being a priority on both sides of the aisle. They may come at it from different angles and different focus, but that is going to be important. I think with our new Attorney General, you're going to see a much more focused effort around the substance abuse and the efforts of the settlement resources to be much more directed and collaborative efforts being forced to come together with whether your efforts on fentanyl, whether it's your efforts on helping folks with recovery. And I noticed on your website that you all actually help with some medically assisted treatment for folks, and that's great. And but there's a lot of public-private partnerships that can be done to help coordinate that and make those dollars get leveraged as best as they possibly can. So I would see that you're going to see that legislation and that task force or that committee that was formed to be refocused. I think that you've already noticed that they've stopped the $45 million investment that they were making in some experimental treatments for specifically veterans, and pulling that money back to look at how they can utilize it. So that's going to be a priority for the General Assembly and their new Attorney General. I think you're going to see a whole conversation under the Safer Kentucky Act, which is being carried by Jared Bowman. the state representative from South Louisville, and there are some components of that that will directly impact the health departments and its role and how it coordinates with law enforcement and the homeless and population. There's going to be some concerns about the effort to, Housing First initiative by HUD is a little different than Care First. And so there may be some differences of opinion over the delivery of services and how that gets done. Of course, I imagine you guys have been part of the conversation at the city level, then their efforts with the CCC. I think, is anybody familiar with that, which is basically the effort of the campus, the community care campus. So that will also be looking for resources, comes back to money. They're asking for $22.5 million and from the state to help with that effort. And, we'll see where that goes. Let's talk a little bit about just money in general. The General Assembly has a $4.5 million in their rainy day fund, $4.5 billion in their rainy day fund. And that's the most money they've ever had. They believe they're going to have about a 1.5 to 1.8% growth in each year of the next biennial budget. So there's a group called the Consensus Forecasting Group that comes together, and they are economists from around the state somehow that provide the information of their best guess based off of all economic indicators for Kentucky about the growth of the general fund, which funds, when you look at the general fund, about 70% of it is for required costs, mandated costs and federal programs that have to be administered, some of which you all probably do and are funded with. And then there's about 30% that is more latitudes within education, latitudes towards projects. What are the priorities in communities? Water, even in 2024 across our state, clean water is still a major investment priority. And so I know MSD has done a tremendous amount of work in our community over the last years, bringing our system up to speed, along with Louisville Water Company doing the same. We're really blessed in our community because we have such a great system. Other communities around the state are not, and they continue to rely on government investment, both at the federal and state level, to keep their systems going. I mentioned the drug epidemics and what we're doing for substance abuse recovery and substance abuse treatments. Housing is going to be a really interesting conversation. A lot of that driven by our mayor in the conversation that more affordable housing has to be built, but yet you have a conflict with where is that going to be built in our community. And the legislature may get involved with some of those decisions, but likely not, meaning they'll leave that to Jefferson County and Louisville Metro and the process of that to figure that out. But they are going to try to find ways to incentivize more affordable housing. There's lots of conversation about affordable housing tax credits, which Kentucky does not utilize, which a lot of other communities do, which means an investor or somebody who wants to build affordable housing can get tax credits from the state set aside. A third party would buy those credits. Usually it's insurance companies. And then the proceeds from the sale of those tax credits get to be put into those investments. And then those investments are paid back over a period of time to the state. And then they just recycle the credits after they're paid back over a period of time. Why is that important? Because interest rates have gone up and it's more expensive, more difficult. And we may just be at a point in time in Kentucky where in the metro areas, it's important to have that tool. We will see. But housing is a cornerstone of good health, and having people live in a safe, reliable environment is a better chance that they'll be healthier if that's the case. So all those things the General Assembly is looking at. I would also say that there's probably going to be a focus on the return, looking at how Medicaid and the Supreme Court's going to Supreme Court's going to make a decision about who the Medicaid providers are in our state, how many, and the termination of that decision of the Supreme Court may have an impact on what the General Assembly does. So right now there's 6 and providers, MCOs as they're called. And so when the Supreme Court rules, the General Assembly Act, do we keep 6? Do we go to 3? There's been debate, and then you may carve out some services. Dental care in Kentucky right now is at a crisis situation under Medicaid population. I don't know if you all see it out there, but it is a crisis. And what happens is emergency rooms feel the brunt of something when no one else is available. And so if you think about the cost of triaging a person that would have a dental crisis or a mouth health issue or oral health issue, and you can avoid them going to the emergency room, that saves everybody a lot of money, and there's a cooperation. But only 12% of the dentists in the state of Kentucky are participating in Medicaid right now. And that is radically low, and it's because they haven't had an increase in their base payment since 1987. So can you imagine working for the same level of an office visit for each one of you of what you do, and you didn't get a pay increase since 1987? That's a lot of delta that we've got to come up with. The good thing is there are resources available. You're going to see nursing homes get their base that they get from Medicaid recertified. That's good. Hospitals and doctors have had that happen already. So Medicaid funding, Medicaid, what it looks like will be a conversation. And what do we do about dental services, not just in Louisville, but statewide, is important. We are working on behalf of, we represent Altria Tobacco, but there is an effort to take all vaping products and make them on a register, just like all other tobacco products are, of which then your regulators could go in and make sure that stores are selling a FDA approved vaping product. There's a lot of product that's out there and targeted at youth, and the youth vaping we've had incidents around the country where people think they're buying one thing, but they're getting another, and it's impactful and it's harmful. So the registry is the only way we knew from years ago how to clarify, what is being sold and by the retailer. And it's going to be a consternation with retailers because they don't like change, just like we don't like change. But it's important for the overall health and the youth targeting. The only way you can control that is at the point of sale. And that's why yes.
Take just a couple minutes and wrap up so we have time for questions.
Okay.
And you have the full board on.
Okay, thank you. And so that's another issue I know that's coming up that's interesting to the health department as well. And I'd say the other overall healthcare issue that you'll see discussed is what is going to be that next investment in the community health workers. And it has been successful. I think the feedback has been good, and the greater coordination between the court system and rehab on drug courts, and even doing greater efforts on reaching out to keeping people out of the corrections if they truly just need to recover and are committed to that effort. That you'll see that dialogue as well. So those are the highlights that I see coming down the path. If I've missed one, raise it. I can give you feedback on it, and but glad to answer any questions and to be helpful where I can. Thank you.
That's perfect. Thank you. And let me just ask a couple questions. One is, and probably you and I can have an offline conversation about how good MSD is doing. As the deputy mayor knows, I have issues there. And
Yeah, I think overall, they were under that consent decree and were under the gun to try to meet those requirements. And with a number of locations around our community that had to be fixed immediately, it seems like they've seen the end of that, or they continue to work through it, but it's much more manageable than it was. Based on what I'm hearing, the legislature is not focused on MSD issues as I know them today.
okay, well, we might put a bug in the President Stiver's ears
Okay.
about that. I'm adamant about that,
Okay.
especially in the largest part of the system.
Okay.
And also pressure on the rural water company as well. Let me do this in terms of opening it up to the board for questions. Deputy Mayor.
Thank you, Madam Chair. And John, thanks for being with us today. I know it's a very busy time for you. Wanted to say on the front end that from the mayor's office perspective, I would say the greatest amount of bill reviews we've been getting involve public health. So shout out to the public health team for all of their work in trying to better inform positions and provide research. I am interested to know, though, are there specific bills related with health? And you alluded to some of this in your opening. Are there specific bills related with health that you feel like have the best shot at like some bipartisan compromise that could then, produce the highest quality piece of legislation? I mean, when I look down the list, a lot of these appear to be, pretty partisan, whether we're talking fluoride or vaccines. But do you see some health related legislation where there really is some good potential for, folks with different perspectives to come together to yield the biggest impact?
I think the efforts on homeless efforts are going to get to that point. And that's a big, as you well know, Deputy Mayor, when you say homelessness, it's a lot of different parts. And the coordination of so many different pieces of what encompasses and what definition is the priority for a homeless individual. It varies so widely, but I do think there's a greater conversation there, and I do think that when the bill, some of it's in the Safer Kentucky Act, but that's in the House. When it gets to the Senate and they finally sit down and really start to think through that, I think that is one. Specifically, the funding opportunity, I think is important there. I think continued efforts on all fronts to utilize the drug settlement money as effectively and efficiently as possible. I think that'll get a bump up as well. So those are the two areas where I think you'll see parties all come together, and from there might be changes that people will have to live with, but I think that overall the goal will be greater resources and more direct benefits because people have a better knowledge about how to utilize them.
And then I wouldn't be doing my job if I didn't ask this, since you mentioned housing and Safer Kentucky. Where do you see as being the biggest educational opportunity as it relates to the piece on funding? You had mentioned, and I think everyone in this meeting knows that part of the concern is for many of us is around the prohibition and the funding the HUD funding restrictions based on treatment status. And that's not to dismiss the need to demonstrate progress. I think it's the need that the concern is around prohibitions with, substance use and the broad definition of criminal behavior. do you see opportunities for education around impact of that and ways to make that, to strengthen that?
I do. Matter of fact, on behalf of a client, I reached out to the sponsor, Representative Bowman, to sit down and talk about some of those specific issues, and we'll probably get that done this week or early next week. So that's what I mean. And there's just, as they get through pieces of legislation like that, everybody picks up a little bit of education, and the Rubik's Cube ends up looking pretty good. Sometimes it's there isn't any chance for dialogue, and things are set and they move fast and they move through. And then in my years of experience, you look back and say, whoops, we missed that opportunity. And I think with this one, they're going to take there's enough conversation going on by enough people that there's going to be some real dialogue there on that.
Okay. Well, I know you represent some good folks, and all that to say, please let us know what you need.
We'll do it.
I think the two of you staying in contact is really important. And one of the areas that's near and dear to my heart are community health workers and training them for healthcare access in those areas of our city that lack providers. And then John, Deputy Mayor, has a lot of work going on the homeless and the coalition, and also clearly the partnership with Norton and all of that. So, and U of L.
Mhm.
So that's good. Other questions from the board? Paula, Dr. Grisani, sorry.
Hi, John.
Hi, Dr. Zani.
What is the lever that needs to be pulled to increase Medicaid reimbursement for health providers like dentists?
The dentists are actively working today to demonstrate the shortage crisis and the just the fact that they haven't had an increase, and what that means to participation. Why would somebody participate when everybody they walks in their office, they lose 75% based off of what they're billing somebody that's a fully insured individual? Or most people, quite honestly, they're paying out of pocket for dental services. And so it's greater advocacy by the dentists themselves, and the recognition by the state, by the Commonwealth as a whole, that this is a necessary function of overall health. I think dental care sometimes doesn't get the same as the rest of your body, physical health, or the rest of vision. Even I think gets more attention sometimes than dental health, because dental health is such an individual responsibility, and we hear that sometimes from folks. And so, but I think more education, legislators knowing that and understanding what's looming out there. If you're a pediatric dental surgeon right now, they lose the majority of folks they see. It's a higher percentage of Medicaid population is their business right now. And I have friends that are in Owensboro, in Paducah, and they're having a hard time keeping their doors open. So it's just getting that education in front of the legislators and in a much broader scope than what's been done before. One of the other hurdles is that the state in the past has said, we'll give you more funding, but you have to give us a source to go get matched, to use the federal match. So, provider taxes are in existence for some, but we've moved hospitals and physicians to an average daily rate reimbursement model versus of their cost versus a set percentage off of Medicare. And we're still stuck on dentistry is still stuck on a percentage of what gets paid to them since 1987. So again, rebasing, education, and promoting, and to legislators the importance of dental care as a whole to the overall health care of Kentucky. So
Don, would it help if the board, and we're gonna let you go at the appropriate time, would consider a position statement on that we can
Absolutely.
send to you.
That would be great.
All right.
That'd be great.
And Dr. Grisani, would you get that prepared?
I will.
Thank you.
Questions? Others?
Margolis?
Yes.
I don't have a question, but it's just a comment, just seconding what has been commented until now. The emergency to get education in front of the legislature regarding dental care, it's so important when we deal with the people not able to get the dental attention, and particularly kids, it's disheartening. So thank you for this, and thank you for the Board of Health of supporting this.
Thank you, Dr.
Thank you.
Severa. Other questions? John, is there anything that we need to do with regard to any needs on the community health worker issue? Or
I would make sure, I would use your own experience there and make sure that legislators, the Jefferson County delegation as a whole, understands the value you've seen from that investment. That to me would be very productive.
okay. Anything else, group? Don?
Yes, ma'am.
Thank you so much. Mother Nature sends a big sun.
Thank you, Mother Nature. I appreciate that.
Yes, John's nickname for me during those days when he was at Humana was Mother Nature. I could send thunderbolts, I could make it rain or monsoon, or I could have the sun out. So, or it could be a cloudy day.
There was a commercial out years ago about natural butter, and the whole commercial is around you don't fool with Mother Nature by having butter versus margarine. And so that's where I came up with, stole the idea. So that's, you don't fool with Mother Nature, you just don't. So
Yeah, so now all of my secrets are, and yours are out.
they're mine. Yeah. And I did have 3 older sisters. That's why God gave me 3 daughters. So.
And a wonderful mother.
That's right. That's right. So
May she rest in peace. All right.
all right. Well, thank you
so
all very
John.
much. Have a great day. Thank you again
too.
for what you do.
Okay, guys. Before we consider certain administrative issues, and we'll flip through those fast, I have a question for each of you on the call. And the mayor has made public statements with regard to his priorities for the city. What public health policy should this board be addressing that are actionable? Not a great policy, so to speak, that doesn't have an action that's executable with it. What should we be advocating for specifically? So I'm going to open the floor, let you think a moment. To say the homeless, that's not what I'm looking for. What I'm looking for is what specifically can be done that's reasonable to be done in the area of public health. Be a moment to think about it. Dr. Patricia.
I think, coming out of the pandemic and seeing the results of vaccination and realizing how far we are regarding childhood vaccination and all the repercussion that the pandemic had on this same issue, this is something that we can work on. JCPS is doing a really wonderful job working with its population, but we still, I think we can support it. It's only one entity that is educational doing public health service. And I think we have, we could support that effort, and we as a supporting.
So for the next board meeting, and let's see, Stacy, I'm going to go to you. If we could have somebody work with Dr. Patricia to get a policy that this board can have that goes out to appropriate people, that would be great. Does that make sense to folks? With input from Deputy Mayor.
I can
I
take
have
that back.
some
Thank you.
nodding of heads. Yes. Okay. Next idea, next priority.
Marta Sanchez here. What about the community health workers
I'm sorry, I
initiative?
can't hear you.
The community health workers initiative,
Yes.
I think that part probably would be important as to educating the community, which helps out a lot when we talk about vaccines, oral hygiene, taking into consideration the influx of immigrants that are coming into, especially Louisville. I think that would be something quite important.
Okay. And Stacy, we turn that to you for policy as well, along with Deputy Mayor George, because that's a special program for me because it's proven effectiveness when done correctly. It takes education because you're teaching people how to fish, so to speak, and training trainers who can then train others. So it's self-sustaining, which is really important. Dumping money is not sustainable. So this way, the community itself, and especially on vaccinations, and as we've learned from COVID, and we probably learned from way back, it cuts through the politics of the situation. It cuts through a whole lot to have the community itself be the influencer and not government, corporate America, or anyone else telling people what to do. I think the individualization of healthcare, the personalization of healthcare is terribly important. Thank you. Others on the board, please. Okay. Let's see. Our meetings, I'm going to move on to chair's update, and we already had Council Johnson. We've already taken that piece. I would also note to each of you that our meetings will be virtual through the June meeting, and we will let the next chair determine how the chair wants to proceed forward. But given that we get a quorum this way, and there's really a lot of logistics for staff to do, et cetera, I think this expedites it. And my goal will always be to be as close to 9:15 as possible, so that people can get back to their practices, classes, etc. Any questions on that? Deputy Mayor George, you're next up for an update. And I made a little note here on Healthy Start and homeless.
Thank you. And yes, I'll let the health department share on some of those pieces just because they've done so much work. But I do want to say on behalf of the mayor's office, we've spent a lot of the past few days really being focused on, again, the legislative reviews. And I would just encourage any of you guys, if you see a piece of legislation focused on public health that you feel like, the mayor's office should take a stronger position on, or maybe doesn't have all the information, to please reach out on that. I think it's good to have focus, but I also think, if any of you all individually, have concerns or have additional perspective, to please share that. We're also very focused on budget planning. It's that time of year again. I said this year it feels a little earlier than it did when I was on the council side, and I think that's because we learned a little bit from last year, and also I think just with the ARP reallocation, a lot of nonprofits are already thinking about the potential. And so all that to say, really focused on legislative review, budgeting, and also as part of that work, we have our language access plans that each agency has to submit and our equity plans. So a lot of planning, 'tis the season. And with that, I'm looking forward to hearing from folks collectively and individually on priorities. Thank you.
Questions for Deputy Mayor?
Oh, if I may, Heidi, I do want to mention, just because John had mentioned, and I think most folks in this meeting know, we did award the Community Care Campus to Volunteers of America in the way of operations. And as part of that, their proposal was committed to delivering family shelter and permanent supportive housing. And of course, we're still very committed to medical respite on the site. So we had a really great meeting yesterday with neighbors and community partners. And so that work is moving forward.
I think that's an outstanding effort. And clearly the collaborative work among various agencies, coalitions, organizations, public, private, academic sectors is prize winning. It's just kudos to everyone involved there, and I trust the results will show that evidence. Chief Medical Officer update, Dr. Single. Signed in. Dr. Single. Anything, Mayor, Deputy Mayor, that you know on that side?
Hi, Heidi. I'm sorry.
Oh, hi.
So this was such an informative meeting. Unfortunately, I'm in the clinic, so I'm just listening and I'm absorbing all that Mr. McCarthy was telling us. And I feel like I have probably a billion things I want to talk to him about. And I'm going to make an effort to schedule an appointment with him. There are so many things. He seems so knowledgeable about all that's going on and how we can get help from the state and help our community here in Louisville. So I'll do that on the side, but this is such an informative first meeting of the year. Truly enjoying it.
Thank you. Thank you very much. As I would say, onward and upward. Right. Stacy Ingram, the interim director's report. Anything else?
We did include details on the pilot we're doing with Kroger, Humana, to have groceries delivered for free to our Healthy Start participants in hopes of increasing food access in our community. So the details of that are in the report as well.
Right. And what's very important to this board, as well as to the community, and with respecting my wonderful conflict of interest being on the foundation board, Humana Foundation board, are the metrics, the evaluation metrics. I'm glad we're feeding people, but I want to know that it's been effective, because there are thousands of efforts to feed people, but we need metrics to show why this is effective. And Deputy Mayor, I call on you.
Thank you. I'm very excited about that. And I just wanted to share a little bit of context. You know, Mayor Greenberg had the opportunity to tour one of the Kroger mobile markets several months ago. And, you know, his question was, why don't we do more of these? And when we met with Kroger, what we realized is, despite the investment that the Metro Council had made in the mobile market, and despite, you know, the anecdotal awareness that, you know, we're increasing accessibility, we don't have the data that demonstrates that those mobile markets are actually reaching the target population, and how, much less how that's linking with outcomes. So apparently they can't use the shopper's card on the mobile markets. And so as part of that, you know, we're looking at, you know, being able to expand out. This is not a replacement for the need for our community to have, more local grocery stores and food options. But as a layer, we recognize this is a thing we can do right now in the way of boosting to take from Kroger expanded access through mobile delivery. And so we're really excited with Humana's generous contribution that we'll be able to evaluate, did we see an impact with families? Healthy Start, they do robust, case management. And so with that, they're going to really be able to do some concentrated work around not only looking at pre and post for what did people use with their shoppers cards before versus what they purchased through mobile through the mobile app, but then also, are we making any other gains? And I know that's still building, and I think we're looking to see the full evaluation plan, but there's so much potential there.
Great. And assuming that whoever is on your side is working with Kenny at the foundation, and because the metrics are important to funding, they're intrinsically tied. And so, but thank you. And hopefully we're looking for a model for the country. So we always dream big, 500 West Main. Thank you very much. Any other items from the department? I'm going to take very short, very brief, any action item from FHC or actually from the coalition, just a minute's worth.
Okay, I have a couple items I'd like to announce.
All right. Very quickly, yes.
Family Health Centers has been working with the Jewish Heritage Foundation and got a HRSA grant to open school-based health at Iroquois. Iroquois
Great.
High School will be doing that in February. Also, we expect to complete our pharmacy in the Hazelwood Shopping Center where our existing Iroquois site is located, and that will expand the ability for persons in that area to receive prescriptions. As you know, some of the pharmacies there, like Walgreens, closed in the last year. So we expect that to happen in February as well.
Great work, Dr. Irwin, from all that you are doing. And I think you have some work with Americana as well, bringing that up to the FHC standards. So hats off to the work that you're getting done. Let's see, immunization. Anything, Patricia or Dr. Eccles?
We don't really have any updates right now. We're coming on kind of slowing down with the flu season with vaccines as far as they're concerned. And we took a break last month, same as the board, and didn't meet. So we will have some updates for you at our February meeting.
Perfect. Ms. Shoemaker, Ashley.
The coalition.
I can't hear you.
Oh, can you hear me? You can hear me now?
Yes.
Okay, for our next meeting is February 12th. Medicaid unwinding is continuing. The Medicaid renewals are going to be ramping up over the next few months as we head into the end of the unwinding. And the open enrollment for qualified health plans ends on January 16th. So that is coming up in less than a week. We want to encourage everyone to make sure that they shop for a plan and choose a plan before the end of open enrollment.
Excellent. And how are we doing on changes in Medicaid?
The state has implemented several flexibilities just within the past few months that has decreased the termination rates. So we are seeing more people getting renewed in coverage.
Good. Good. We have a long way to go, I guess, but we will do it. I know it. Questions for Ms. Shoemaker? Dr. Hargett had to see patients. Delmer Manson is out today, and this may not be the meeting they alternate for Greater Louisville Inc. And JCPS clearly is in their third day of back to school, so I can hardly imagine. And I know some of you have children in the school system, and I hope things are going as well as humanly possible. Any comments about any of the organizations? Okay, is there any new business to come before the board, announcements from the groups you're affiliated with, or in general, what's going on in the community that would be good to share with the board? Community advisors welcome to contribute.
Heidi, this is Ted Smith. I've got a quick update if
Yes,
you got
Dr.
the time.
Smith.
Yeah, so the CDC reached out to the state in November asking about our measles wastewater assay. And we've had 2 subsequent meetings with the state and the CDC. And so just there's an update. Last year we had a measles issue in Kentucky, and we had a wastewater assay that was able to detect it. And so it looks like the CDC is going to pursue funding to develop that assay with us. So I think that's good news for all the hard work and the commitment that the health department has provided. So stay tuned. We'll see if that funding comes through.
Yeah, we are blessed first with the partnership between the university as well as with the Christina Brown Byron Institute. That allows us to transform those elements of life that are critical to us, air, water, et cetera, et cetera. And so thank you for that effort. And the chair has added Ted to our community advisor board. So he will be joining us regularly for our meetings so that we get that perspective. Let's see. Any other announcements or comments? So a quick start to the year. I would also say that, and I'm going to mess this up enormously, Dr. Bautista Severa is going to chair the perspective session in February, and has invited Amos Mizurumana. Is that the way he says his name? I'm not sure. Yes, I'm getting it. Yes. Who is the mayor's director of the Office of Immigrant Affairs, to discuss with the board the unmet needs, public health needs for immigrants. I think it'll be an interesting session for us. I would also commend to each of you, if you will please offer me some feedback on areas or speakers for the upcoming meetings that this chair has remaining. And I'm sure Dr. Bautista Severa would appreciate those as well. First, and because it's important that we meet the needs of people who are in your large networks and are sure we're exceeding expectations of what a public health board offers. Anything else to come before the board? Yes. Is that Dean McKinney? I can't.
Yes, it is.
Okay.
Thanks, Heidi. Just a quick announcement that interest in public health education remains strong. We're in record territory this year with the enrollment. It's going gangbusters here. And so it is very, very heartening to see the community is responding with the interest in public health, and that there'll be another generation of highly educated students that will be proceeding through our programs here. We've had the largest growth of any of the programs, the units in the University of Louisville over the past decade. And We also, as part of that, I think we're being recognized as well for excellence in teaching. There are annually is a listing of the top 4 educators at the university. This year, of those top 4, we had 2 of them. So we're the smallest unit in the University of Louisville, the smallest number of faculty, and we're the newest unit, but we have 2 of the top 4 top teachers within the university system as recognized by the student body. So we're very pleased to hear that.
Hats off to you and your team for that. And Chair also serves on the Public Health Information Science Advisory Council, and so for that as well this year. And of coordination and collaboration with the community. Anyone else? Well, just 1 second, a board member just texted. Anything else? No. Then our next meeting is February 7th, 8 a.m. virtual. The Director of the Office of Immigrant Affairs. And so with that, Chair will entertain a motion to adjourn.
Move to adjourn.
Second. Any opposition? This meeting stands adjourned. A big hug to all of you, a virtual hug, and I wish, as I mentioned in the beginning, for the best year ever in 2024. May it offer you nothing but its very best. Take good care, stay and be well.
Thank you.
Goodbye, everyone.
Goodbye. Thank you.
Goodbye.